Hello everyone, welcome to Unacademy Future Doctors. Am I audible and visible? Let me know, then we'll start. Am I audible and visible? Let me know. Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. I myself Dr. Dipti. I'm MD PhD Physiology and I'm Associate Professor educating MBBS, MD Physiotherapy, Nursing and Dental students. I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two kinds of subscription. One that is plus subscription. Here, you can choose the best from the best. You can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access Question Bank, which is having more than 25,000 questions. You can compete in the live test and quizzes, and within 12 months, we are coming with our printed notes. Now, next is the iconic subscription. Here, your access to the best from two of the best. And which are these two? One, that is Unacademy and Prep Ladder with Unacademy. Here, you can have well-structured live batches, recorded classes which covers your full syllabus. You can have Question Bank, which is having more than 25,000 questions, competitive live tests as well as quizzes, comprehensive printed and digital notes. And second one, that is Unacademy and Prep Ladder. With Prep Ladder, here you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and much more, rapid revision and snapshots and treasures and 2021 Dream Notes. We also have added certain special class feature, and we make the special class interactive. You can attend live classes as well as participate in the live chat. You can have raise a hand facility. You can poll for the learner. You can never miss a class. As always, you are notified for the class. You can get lecture notes. You can download lecture notes and get access to the recorded sessions too. And you can attend classes anywhere and at any time. Also, we have updated and highly effective question bank, which is having more than 25,000 high-yield clinical questions, which are based on latest exam pattern, which includes detailed explanation too. These are our NEET PG 2021 toppers. This is our schedule for test rituals. We have pre-test rituals as well as plus batch test rituals. We also have started Focus FMG 2022 comprehensive batch, which has been started from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch, which was started from 15 December, that is for 3 months. You can subscribe, you can use my code DIPTI10 to get 10% discount. Okay, here for 2022 we have a special offer for you all, that for 1st, 2nd and 3rd January, if you subscribe our channel, you will get 22% off instead of 10%. You can use my code and get 22% off. Okay, now, so today we'll start with our foundation course. Okay, now, so foundation course, MCI, Medical Council of India, introduced foundation course for MBBS student. If Medical Council has introduced this course, there must be some purpose. Okay, why Medical Council introduced this course? This is very important. Since last 2 years, this course is introduced. Once you get your admission in your medical college, first 1 month, that is your this foundation course, you will be taught certain things that is included in foundation course. Okay, now what is the purpose of foundation course? Why this foundation course is assigned? Number one purpose, that is to orient the student. Orientation, that where the student has to study. Orientation of medical college, orientation of environment. So all teachers, they help you to orient. Okay, watch recorded class. Yes, you can. What happened? But be regular, Yuvraj. As I told you, I think most of the students, they are watching recorded classes also. That is fine, but try to finish your class before tomorrow's class. From tomorrow onwards, we'll be having single class. Okay, so students will not find very much difficulty today, because that is some strategy session and this is your foundation course. So I kept two classes, otherwise from tomorrow onwards we'll be having one class only. Okay, now so here first is orientation. So you will be okay, no issues, fine, good. No issues, you can watch recorded class too. Now, so orientation to the college, that is first purpose of foundation course. Okay, second purpose of foundation course is, you are medical students, they are given certain skills, equipped with skills which is required for the care of patient. Nowadays, I think you all are knowing that abuse, doctors are treated badly. Okay, welcome, Yuvraj, welcome. So, what happens nowadays? I think you must be knowing that doctors are treated badly by students, by patients, sorry. Why is it so? Because of certain skills doctors, they don't have. So these skills are taught to you because doctors are very precious for the society. So if any doctor is beaten or abused, or sometimes may hazardous health injuries may be there to the doctors by patients and their relatives. Sometimes there are both the way, fault is on both the sides. No, I'm not telling that only patient is at fault or doctor is at fault. Okay, so certain skills, at least we cannot change the population, but what can we do is we can acquire certain skills, we can change ourselves. Issue, hello, welcome to the class. You were absent in the previous class, 10 a.m., 10 p.m. Sorry, you were not there in first class. Watch that class, okay? I gave suggestions for planning how to study. That was an important class. Watch it. Okay. Now, so here, issue. Are you first MBBS student, or you are going to complete, or you are going to give exams for first MBBS? Okay. Issue, you are planning to take admission in first MBBS, or you are going to give exams? Your first MBBS student or completed first? Not, maybe connection loss. Okay, then okay, let me know. Now, so here in foundation course as well as in some lectures, we will teach doctors that how they acquire certain skills so that they can treat patients quite differently as well as quite efficiently. So that is the purpose of foundation course. Okay, now here in foundation course we will discuss certain topics. One of the topic, that is interpersonal relationship. Interpersonal That is our today's topic, interpersonal relationship. Okay, so how that is developed, how it is maintained, as well as we will also discuss so many other topics like doctor patient relationship, how you have relationship with your patient. Okay, how can you treat them well. So many other topics we will discuss. Function as a team. If you are there in the corporate hospital, you can work as a team. Okay, or stress management, time management. Hmm? How can you use technology in your medical field? So many topics, different topics rather than your medical studies, that we will discuss in foundation course. I think one lecture per week for this foundation course, so don't worry that we will not going to take the whole syllabus with this foundation course. Okay, so now first one, that is interpersonal relationship, or you can say interpersonal communication. What is it? It is communication between two persons. Here in medical field, this is communication between doctor and patient. Okay, why this interpersonal relationship and communication is very important? That is, it builds respect, it builds trust, loyalty, as well as it also provides us support, care, and love. That is required everywhere, not only between doctor and patient, but between two persons. If you don't have proper communication, then what happens? You don't feel supported, you don't feel that you are cared, you are loved one. Okay, so this is just interpersonal between two persons. These are the relationships. Okay, but here as the doctor, we have to maintain this relationship with our patient so that we can treat the patient nicely. Okay, as well as this is also important, this interpersonal relationship, that is important for physical and mental well-being. Physical and mental well-being. There is strong link between two person relations of two persons, that is interpersonal relationship, that we will discuss. Okay, now another important thing here is interpersonal relationship at workplace is also very important. Why? Because most of the time we are spending at our work, is it around 8 hours to 10 hours a day. So if we don't have good relationship, interpersonal relationship at our workplace, what happens? It has effect on our work. Okay, it has impact on our work. And this is also very important to maintain respectful communication. Suppose if you don't have good relations with your colleagues, so what happens? You don't like to go to college or you don't like to go to school. So you can say that this is very important thing. You have good relations at your workplace. Your workplace is school or college. So this is to be learned here also. Same thing when you be a doctor, and if you don't have good interpersonal relationships at your hospital, what happens? Nobody will follow you. Nobody follows you, that whatever you give instruction, whatever instruction you give, nobody will follow it. This is very important, this interpersonal relationship at workplace. Okay, that is also to be learned by a doctor to become a successful doctor. This all tips, because our profession is not like, we are not dealing with machines, we are dealing with human being. Okay, and each and every human being has emotions. So sometimes they may not behave nicely with you, because why? Because they may have some depression, or some, they may pass through some other situation, so they didn't talk to you properly. So it doesn't mean that you also started talking with them in the same way. So that quality you have to acquire to improve your interpersonal relationship at workplace with the patients and all. Sometimes patient is also not behaving nicely with you. Why? Because he or she may be suffering. He or she has pain, or he or she might have some other problems too. You might not be knowing financial problem or so many other problems, and you also started behaving that you people are like this and all. Then what happens? There is a blast, and this is one of the reason for the fight at hospital. So many times this has happened nowadays. To prevent this, MCI has included all these topics in medical studies. Am I clear? Okay. So next is, as we have discussed, what is interpersonal communication or interpersonal skills. That is a skill to communicate between two persons. Either the communication is face to face. Most of the time you have the communication face to face, okay, or sometimes like us we have communication on internet. Is it internet communication also? That also requires interpersonal communication. If somebody is sending me messages and I am not replying, then I am not acquiring the skill. Or on the phone also sometimes. Suppose you are sending some investigation to some laboratory people and you are not talking properly to that person who is sitting in the laboratory, then what happens? The person will not report nicely to you. So that is also important. So all this face to face interpersonal relations, on the internet, on the phone, okay, on the mobile, through messages also. So always all this communication must be fruitful as well as that should follow normal conversations. Okay, so this is very important. Next is, why do doctors need interperson relationship? Why we require interpersonal relationship? So the reason is, that is, first thing, why do we require this interpersonal relationship? That is to understand patient. And if you understand patient properly, then only you can treat the patient. Treatment of patient. Okay. So for that we require good interpersonal relationship. Okay. If suppose you are not talking properly nicely to your patient, so what happens? Your patient will not give you good history, will not cooperate you. Suppose if you are in hurry, you are not giving much time to your patient, that just फटाफट फटाफट आप पूछ लेते हैं इनसे, तो क्या होगा? He also is not interested to answer you. Okay, and that affects the treatment. Sometimes he may hide something. If he is having some history of diabetes or hypertension, so he may not tell you. Am I clear? So always you maintain good interpersonal relationship with your patients too. That it helps to make the patient understand that he or she has to cooperate you, and this gives you better results. Your treatment will be effective. Okay, because sometimes what happens in medical field, some of the doctor may be very much you can say intelligent, but not getting so many patients. Why? Because of lack of this all skills, and then they are getting depressed. Am I clear? So this is one of the reason why MCI added all these topics in your medical studies. So it is not like that. You always have to think from the patient's side. Suppose patient is not behaving nicely with you, what does it mean? He might have some problem. This is the reason he or she is not behaving. Okay, so this is very important as a doctor, so that you can treat your patient well. This is the only thing which is required. Okay, another thing also, this interpersonal relationship, it also involves performance and behavior of a doctor. That involves any interaction with others, not only with patient. As I told you, we do not require to have to develop this skill for patient only, but for other staff members. Suppose you are, after completing your degree, if you are working in multi-speciality hospital, so what happens in multi-speciality hospital? If you are working, then so you have to work with nursing staff, Okay, you have to work with class 4, that is sweeper and all. You have to work with laboratory technician. Hmm? If you are in surgery, you have to work with your assistant. So to all of them, you have the ability to communicate nicely. Otherwise, what happens? They will not cooperate you. And if they will not cooperate you, then you feel that you cannot perform your job well. Okay? So, what is the purpose of developing interpersonal relationship? One, that is to feel security, sense of comfort, sense of security and comfort. Okay. Second thing, by developing this interpersonal relationship, you can get trust of the patient. You can get cooperation from your patient. Sometimes some doctors say, or some people say that this patient is cooperative to this doctor, not to this one. Why? That all depends on your capacity, how you can convince, how you are convincing the person. Okay, so that is trust and cooperation. Okay, third thing, it increases communication. So if the communication increases, then you can easily get all the histories and you can treat your patient properly. Okay, another, also you can improve socialization. You can be, socialization is important. Why socialization? Because we are social animal. If you are staying alone without anybody else, then you feel depressed. So this interpersonal relationship also improve your socialization. And another important, this, it also maintains positive feeling. You feel positive that yes, I did good job, people behaves nicely with me. So these are the purpose of developing interpersonal relationship. Now, another thing is, certain barriers are there you may face while developing this interpersonal relationship with patients mainly. First barrier, that is gender variation. Suppose the patient is very old, so you may have a barrier of gender. Okay. Uh, Sorry, gender, that is, if you are a male and you have to take history from a female, then that is a barrier. So keep some person, sister or somebody having same gender. Okay. Second thing is lack of honesty. Sometimes you are, or the patient is not honest, not giving proper history, so that is also a barrier for you. Third, lack of compatibility. Compatibility means you are compatible with your patient, then he or she will cooperate you easily. So that also may be the barrier. Security. Patient feels that I am not secure here, then he will not cooperate you. Okay, lack of respect for others. If you are a doctor, this is one of the respectful job. So you have to maintain your dignity. Okay, if you had a fight with somebody in front of patient, then what happens? Your patient will not respect you. So always you have that particular behavior so that your patient respect you. Okay, then fear of rejection. Sometimes patients, they don't give history because they feel that the doctor will reject it, then also he or she will not give you the history. And sometimes pre-existing psychological problem, the patient is having problem with the doctor, that this doctor is not good or all the doctors are like this, so then also this interpersonal relationship can be affected. Okay, then next barrier is situation barrier. Situation barrier means the situation is such a way that patient cannot give all the history to you, like complex interaction. Interaction is not very easy. You are asking questions in medical terminology, so that is complex interaction, that should not be done. Always try to ask questions in local languages. Okay, then second, adverse environmental situation. Means environment is not proper that patient can explain or can tell you all his or her problems. Like high density of individual. If your OPD is full of patients and so many patients are there in queue, then that is also you are not providing privacy. Then also there is a barrier for interpersonal relationship. Okay, lack of distance. Make a particular distance. Don't be so much close to the patient. So then also the relationship cannot be maintained. Lack of time. If you are not giving proper time to the patient, if you are busy, still you have to give some time to your patients. Okay, so that is physical barrier. Then socio-cultural barrier, like cultural diversity. Your culture and patient's culture is quite different. Ethical diversity or social diversity or language diversity, these all are the socio-cultural barriers. Okay, now, so how to establish interpersonal relationship? There are certain tips. One, that is be open and vulnerable. Okay, but along with that, be open, but along with that, establish healthy boundaries. If you are very much open with your patient, then what happens? Patient behaves like your friend and start talking with you. That is also not true. We have to maintain healthy boundaries too. So that is very important. Like we are maintaining our boundaries with the students. Same way, you also have to learn to establish healthy boundaries. Okay. Second is you make a practice active listening. You must be a good listener. Listen to the patient, not just giving your advices. Okay, then you give respect also if you are not agree with the person. So that is not only for patient but for all the persons. Okay, and try to give empathy or sympathy. You can see that if patient is suffering, you just give or treat him with warm words. Okay, so that he feels that no, this is the person who is listening me properly. With a positive attitude, always keep positive attitude. That is also very important thing to establish interpersonal relationship. Now if you have good interpersonal relationship, what happens? You will be having higher emotional intelligence. Okay, you can easily connect with other people, you can maintain your relationship, you can also understand how to motivate the person, and you can also be a good physician. Okay, so this is also very important. Now, importance of interpersonal communication. So lastly, the same thing, but that is which is required for a doctor: interpersonal communication with patient. Why is it important? Why this interpersonal communication with patient is important? That is to understand the patient and treat him as individual, not like a patient, hmm, rather than a diseased condition. And therefore, if you maintain this healthy relationship with your patient, what happens? Your patient will cooperate you, cooperation you will get, and as you get cooperation, you can treat the patient better than somebody else. If you are treating him or her better, then you can gain trust of the patient. That is the thing which we need. Otherwise, what happens? Patient says that this doctor is not good. Why not good? Because he is not listening us. He is not talking nicely to us. Okay. So these all things, interpersonal communication is required. Okay. So these are effective communication skills. We have already discussed active listening, written communication, non-verbal communication, presentation skills, also patient education, compassion to your job, okay, cultural awareness, personal connections, trust, verbal communication. Okay, so this is all about today's topic, interpersonal relationship. Another thing is, from this foundation topics, sometimes short notes will be asked. So prepare these topics too. Okay. Thank you. If you like my video, you can like it, you can share with your friends and subscribe our channel on Academy Future Doctors.